My project today is going to be over a health fair. So on this, we're first going to look at the homeless in the United States, the numbers. So this is a map of the United States, and each little state shows how many people there have been homeless in 2016. So in Illinois, there was 11,590 people. In Indiana, there was 5,798. And in our focus area, Kentucky, where Louisville is located, there's 4,273 people. In 2016, there was over 500,000 people who were homeless. Hawaii had over 5,000 people in their 400,000 population. With the return to school, 1.4 million children were unable to provide addresses to their teachers, which is awful, and kids hate it and they feel really embarrassed about it, which stinks, and I hate it for them, because other kids can be really mean. And then you got to think that not all of them are actually counted who are homeless, because there's so many people who are moving around from friend to friend's house or family member to family member house. They aren't always staying on the streets, and they aren't always in the shelters. So volunteering. Over here I have a little circle. It shows a good community framework. We have things like in the political area, like collaboration and sense of ownership, and then cultural has cultural vitality and sense of belonging. And then economic is local economy and life cycle values. And then environment has mobility and resilience. And then social is support systems and socialization and welcoming. And then, so also with volunteering, I'm going to need a lot of people from the medical field to sign up and come and join us and volunteer their time. People who are doctors to do physicals, nurses to do blood pressures, dietitians to teach about healthy diets, social workers to help with medications. Anyone who's willing to teach is more than welcome to join, or just would like to help fill up goodie bags at the end. We are taking donations, all kinds of donations: deodorants, shampoos, conditioners, toothbrushes, hairbrushes, toothpaste, feminine products, because those can be stupid expensive. But we want you to come with good positive attitudes and smiles, because that's very important. So medications. Medications are extremely expensive, and whenever you have to have them to survive, they're very important that you get them. For example, in 2015, 30.3 million people had type 1 and type 2 diabetes, which doesn't sound like a lot, but really it is to have this disease. And those with type 1, they rely on insulin in the medication form to be given to them for them to survive, because their body is not making it. And insulin is a very expensive medication. It's crazy expensive. The other hand, type 2, you could have to take medicine to survive, but there's also the chance that you might just have to have a different diet or exercise more. There's a lot of different things that they can try before you have to take the medication with that. And also, if you don't have insurance, you could be paying for this medication all the way out of pocket, and that gets really expensive really fast. And then you're going to have limited resources for food and limited resources to pay for rent. And then we have mental illness, which is very real. I know that it may be misconstrued because you can't see it, so people don't really think of it as a problem, but it still is a problem, and there is very limited resources for it, especially if you don't have a lot of funds to back it up. But that's what I want to do at this health fair. I want to have people there who can help you and you can seek help from, and give you ideas of better handling your situation, because it is very important that you get treated for that. Diet. So we have food deserts. Food deserts are areas with a populations of 1,000 to 8,000 people, and they don't have any grocery stores within 1 mile radiuses of them. So, the areas in red on this chart, those are considered food deserts. They are very much have a lot of population without homes, and typically if you don't have a home, you probably won't have enough money for a car either. So how would you be able to get to those grocery stores? How are you going to be able to go get those foods that you need? I also want this to be a time to teach about healthy, affordable food options and things to make your lifestyle a lot healthier, and give you like a diet plan and things that you can afford. Healthcare. So healthcare can be very difficult to obtain, and there's a lot of underuse that happens with it. It can lead to a lot of wrong diagnoses and several different things. You always need the 3 domains to be balanced though at all times, because that makes for the best healthcare possible. This is a flyer that I have created. This is the one that I would be hanging up on like bench places, telephone poles, just to get the word out there that we are going to be doing a health fair that includes like physicals, blood pressures, diet options, mental health information, and goodie bags. It also says the time and the location. This is an area that is very local and in the middle of like everything, so people can really get to it really well. And let me go back real quick. And then sorry about that. And then this slide is the flyer that I created for my volunteers. So I have like the type of people that I'm looking for, like doctors, dietitians, nurses, social workers, anyone who is willing to help fill goodie bags. I also requested for people to be donors, to donate like things like deodorant, toothpaste, toothbrushes, hairbrushes, feminine products, non-perishable food items, and then I also said the location again and the time. This is a very meaningful thing. This is going to help a lot of people. This is going to be something that changes somebody's lives and helps them get back on their feet. So many times it is taken for granted, and this is a great time for people to give back to their community and show them that they do matter to us, and we want them to succeed and be great people and do great things. So I think that's why we really need to consider putting a health fair in every town, in every city frequently, and to keep this going. Thank you.